How does letrozole help PCOS fertility? Imagine trying to get pregnant but your ovaries just aren't cooperating. For women with polycystic ovary syndrome, or PCOS, irregular or absent ovulation is common. That's where letrozole comes into play. It's a medication that helps women with PCOS ovulate more regularly, increasing their chances of pregnancy. Letrozole works by blocking an enzyme called aromatase. Aromatase normally converts androgens, which are male hormones, into estrogen. When letrozole inhibits this enzyme, estrogen levels in the body drop temporarily. This decrease in estrogen reduces the negative feedback on the brain's hypothalamic pituitary-ovarian axis. As a result, the brain signals the ovaries to produce more follicle-stimulating hormone, or FSH. This hormone is crucial because it stimulates the ovaries to develop follicles, which contain eggs. When a follicle matures, it releases an egg during ovulation. So, by increasing FSH, letrozole encourages the ovaries to produce and releases a healthy egg, helping women with PCOS ovulate regularly. Compared to other medications like clomiphene citrate, letrozole tends to produce a more natural ovulation pattern. It usually results in the development of a single dominant follicle, which lowers the chance of multiple pregnancies. It also has less impact on the lining of the uterus and cervical mucus, both of which are important for successful implantation and sperm movement. Because of its short half-life, letrozole clears from the body quickly, which means it's less likely to cause prolonged low estrogen levels that could interfere with preparing the uterus for pregnancy. Research supports using letrozole as a first choice for women with PCOS who don't respond well to clomiphene. Studies show higher rates of ovulation, pregnancy, and live births with letrozole, and it doesn't significantly increase the risk of ovarian hyperstimulation syndrome or multiple pregnancies. Typically, doctors prescribe letrozole in doses from 2.5 milligrams up to 7.5 milligrams daily 4-5 days early in the menstrual cycle, usually starting between days 2 and 6. The exact timing and dosage depend on individual response and clinical judgment. While letrozole is mainly used for ovulation induction in PCOS, it's also sometimes considered for women with endometriosis-related infertility because of its estrogen-lowering effects. However, its primary role remains helping women with PCOS ovulate more regularly. It's important to remember that each person's situation is unique, so treatment plans should always be personalized by a healthcare professional. In summary, letrozole helps improve fertility in women with PCOS by lowering estrogen levels through aromatase inhibition. This stimulates the brain to produce more FSH, which in turn encourages the ovaries to develop and releases a mature egg. It supports better chances of ovulation, pregnancy, and live birth, often with fewer risks of multiple pregnancies or adverse effects on the uterus. Always consult a fertility specialist to see if letrozole is the right option for you, as individual health conditions and fertility goals vary.